Hi, I'm Tina Cosby with the Indianapolis stations of Radio One, and we are going to be talking today about Open Enrollment 2023, some tips for navigating the marketplace. And we have some experts from Eskenazi Health joining us, thank goodness, because I have no idea and I'm going to learn something about it too. Our guests are Victoria Evans and Marcus King. Victoria, Marcus, welcome. How are you?
I'm doing good. How are you?
Doing well, doing well.
I'm
I know
doing
you both
good.
are busy. Yeah, go ahead, Marcus. I'm sorry.
No, I'm doing good. Thank
Oh,
you.
you're doing good. Okay, okay. So, for those who may not necessarily, be aware, I mean, there's so many different terms that are applied to enrollment, open enrollment in the season, what have you. We've got getting ready for the marketplace, affordable care, Obama. So, can you either or both of you put it in perspective and translate for us what exactly we're about to be talking about?
You or me, Marcus?
So I can go. So,
Tag, you're
open
it, Marcus.
enrollment through the federal facilitated marketplace is November 1st. This year runs through January the 15th, 2023.
Uh,
Um, we're approaching December 15th, which is an important date because if you want your coverage to start on January 1st, the application and a payment to the managed care entity needs to be made by December 15th to start that coverage on January 1st. So we're quickly reaching that deadline. Now, if that's not, or if that doesn't happen, or that can't happen this year, they have extended it till January the 15th. So we want to, the important thing is that we get covered. So you wouldn't be covered January 1st, anything after December 15th, but your coverage would start February 1st if you were to submit that application and enroll before January 15th deadline.
And and I think for me, like when we're talking about open enrollment, for those individuals who are fortunate enough to be offered coverage options through their employer, we have an open enrollment period to kind of review and make changes to our insurance for the upcoming year. So essentially, the open enrollment that's offered for the marketplace, it's very similar, except it's targeting a different audience. And so this is specifically for those individuals who may not have insurance options through their employer, may be over income for state coverage programs like Medicaid or HIP. And so this open enrollment period gives them the opportunity to explore what their coverage options could be in 2023, and then make some decisions regarding plans, and then kind of prepare for those payments as we enter the new year, so that if they do need to seek out health care, then they have insurance for that treatment.
so, an example of who would be eligible. You gave situations, but perhaps an example of who would be eligible to shop the marketplace and be covered.
Yeah, so I think um, when we think about open enrollment in the federal marketplace, it's really targeting individuals who don't currently have insurance coverage or options available and are at a federal poverty level that's over what we would consider for state programs like Medicaid and Healthy Indiana Plan. And so, generally speaking, you're usually in that 201 to 400% category, a little less depending on what Medicaid program you're being compared to.
Yeah. So, who how can you make people, I mean, are there people that are eligible for this type of coverage that have no idea that they're eligible for it? Yeah, okay, you're nodding.
Mhm.
And if so, how can we make them aware of the fact that this exists? I mean, this opportunity exists, and it's really good from what I've been reading. It's fantastic coverage.
Yeah, so I think for us, generally speaking, if you currently don't have insurance or are concerned about carrying insurance into the new year, um, then we want you to come and see us, right? Because our team of financial counseling experts can screen individuals for the state programs. And if you're over income and don't meet those guidelines, then we can kind of transition that conversation and start looking at marketplace options. And if they qualify and are interested, our team helps go through that application process and can walk individuals through that so that way they can secure the insurance coverage that they need for 2023. So for me, if you don't have coverage or insurance, or you're concerned that you may lose it at the beginning of the year, then we would just recommend that you come out and have a conversation, and we're happy to explore options with you and kind of help you through that process.
So Marcus, what's one of the more common visits that you get?
I'm sorry.
What's one of the more common visits that you see when people talk to you, when you're counseling people? What's the most common thing you see?
Well, the most common thing, is people come in and just want some direction, right? I think the one thing that the Affordable Care Act has done in the marketplace is given folks that don't, have an opportunity to attain health coverage through their job or through our Indiana health coverage program, a path to health care. So, people, they don't really understand, how the health coverage world works. So the biggest thing that we see most of the time is just individuals who have questions, who just need some direction. Hey, what path should I go down? Do I qualify for Indiana Health Coverage Program? Do I qualify for the marketplace? Should I ask a couple more questions to my department at my job, or what questions should I ask, and things like that?
So how many people in the state of Indiana do you think, well, roughly, are covered under the plan? And how many more could be? Because there's got to be folks out there that need it and would qualify for it that are probably slipping through the cracks.
Yeah, I don't know that I have estimates of the number of patients who are currently on like a state health coverage plan like Medicaid, Healthy Indiana plan versus the marketplace. I just know that we're busy over here at Eskenazi Health assisting our patients and the community. So the need is there. And I don't necessarily know, like Marcus said, if everybody understands like what their options are, and how time sensitive, things can be, especially from a marketplace perspective. Because if you don't take advantage of open enrollment, then there's only certain, life events that would create a special enrollment period for you at any other time in 2023.
So the characteristics of let's take a closer look at what exactly the Healthy Indiana plan. I mean, what are the income requirements? Adults, children, who's covered? I mean, what are the specifics of that plan? Just taking a look at one of them.
The Healthy Indiana plan has an income guideline of 138% of the federal poverty level. Now that can mean a wide range of income depending on your household size, how you file taxes, and things like that. So that's why we recommend just coming in and meeting with one of our financial counseling experts, so they can kind of calculate those things for you and get you geared toward the right path. And then, with the marketplace deadline being January the 15th, we want to get as many people as we can in before that, because if one of the Indiana health coverage programs isn't an option for you, we need to start having those marketplace discussions before that date.
Are there plans that are specifically for children? Are there plans specifically for adults within a certain demographic? Are there plans that are specific for senior citizens? I mean, what all can we look at here?
So I think when we talk about like Medicaid and state coverage programs, Healthy Indiana plan is the one that comes up most frequently because it is for adults ages 19 to 64. But there are coverage options for children, Hoosier Health Wise, CHIP, if they're over income for the Hoosier Healthwise. And then the federal poverty level requirements are adjusted depending on, other categories that individuals may fit into, age, blind, or disabled. MedWorks for individuals who may be disabled but are currently working. And so I think Healthy Indiana Plan captures maybe the largest population of adults who would potentially qualify, but the income levels that are acceptable do go up depending on the specific scenarios or situations of the patients and their families.
So what's all included? Dental, vision, hospital? I mean, what pharmacy? I mean, are they broken up? I mean, can you buy them in chunks or pieces, or is it all inclusive? I guess I was, wondering how that would work.
From like a Medicaid, Indiana state coverage plan perspective, or like marketplace?
Let's look at
They're kind of different.
Can we do both?
Yeah.
Okay, let's do
So-
marketplace first. Marketplace.
Okay.
First.
So with the marketplace, you're going to have several options. You'll have some options for plans that include vision and dental. And then you're going to have options for plans that just include healthcare, but then you can purchase a standalone vision or dental plan along with that.
I see.
So you have options. Some come with both, but if the plan you select doesn't, you'll have an option for a standalone vision or dental plan to go along with it.
Gotcha. Okay, and Victoria.
And then I was going to say, generally speaking, for the Healthy Indiana Plan and the Hoosier Healthwise and things like that for the children, it covers multiple, so like dental, vision, like healthcare services. And so once you've gone through that application process and then you've been approved, then you can start seeking those services.
So you were talking about making your payments so that you have coverage or whatever. What's the range of these payments because if you can't afford employer insurance and you're getting this insurance, are the payments, I don't know, regulated at some point, or is there a range in terms of how far the payments can go or how high they can go?
I think the payment amounts vary depending on the individual and or their household. They do fluctuate depending on income, right? And so the payment for somebody who has an FPL of 200% is going to, look different than somebody who's at like 400%. So it really kind of depends on the individual and or their family. And there are some tax benefits that you can take advantage of, if you qualify for those scenarios as well, that make it a little bit, that can help make it more affordable. But generally speaking, if you have options through an employer, from our experience, that usually ends up being more affordable from a cost perspective.
Oh, okay. So navigating the marketplace and your best advice or information that you can share in terms of navigating the marketplace, your best. Yeah, you're both smiling. So I'm thinking maybe there's more to that. But what are some of the best practices and best tips for navigate other than coming to see you, or in addition to coming to see you? Maybe that's where you start, coming to see both of you.
Yeah, so I would say, when you think about the marketplace, it's something that you can do, on your own. You don't have to necessarily come see anybody in order to submit that application. But I think the difference comes in is, some people shy away from some things we're not comfortable with. So just kind of be comfortable with it, submit the application. There's nothing, wrong with submitting an application. And if you have questions, bring your login information in with you. We'd be happy to sit down and answer questions and compare plans, benefits and things to find the right fit, for any particular person.
So, any examples of what the things that might be causing discomfort? You say things people are uncomfortable with.
So I think um, when you go through the application process and you're presented with options, I think trying to understand the difference in, you know, the bronze, the silver, and the gold plans. Um, is my provider like in network? Um, can I afford this premium? If I pick, a bronze plan over a gold plan, like what does that really mean? And so I think that makes the process um, uncomfortable or a little bit more challenging, because I think you have this idea that you're going to go on, to this website and apply for coverage, and it's going to be there, and it is. But there are all these questions that you then have to like ask yourself, um, to try to decide, what's the best option or what's the best plan for me. And I think that can be uncomfortable. And not everybody speaks like insurance language, and so they don't necessarily, so they don't understand, um, all of the differences. And depending on their individual circumstance, picking a bronze plan, could, impact them pretty significantly, versus like a gold plan. So I think that makes it a little uncomfortable and challenging, and then, makes kind of going through the process maybe not as pleasant as you would like it.
Yeah, I would say there could be some barriers with technology too. Not
Mhm.
everybody's comfortable
Ah,
with registering an account, getting a username and password. Some people aren't comfortable with a computer,
yeah.
but we're here to help. So if you fall into that category too, we can assist as well.
Yeah, and a lot of people don't like to give out the information, personal information necessary just to create a profile, because
Right.
people are just. And then there are those who simply just do not do technology. So the next question is, if I okay, for instance, I need help navigating the marketplace. How difficult is it to get in touch with you, either of you, or what should I do, or what should a person do to access the help that is being offered here?
So, fortunately, at Eskenazi Health, we have team members available in all of our primary care locations, at the main hospital, in our financial counseling suite, in our emergency department. And so we're very fortunate to be part of a healthcare organization that has such a strong team to support our patients and our community. So, as far as like an access perspective, the team does a really good job at getting people in. And we have appointments that are available via telehealth. We can do appointments in person. We accommodate walk ins as well. And we have an 855 number where patients or community members can call in with general questions or concerns. And if they decide that, yes, I need to meet with somebody, then they can get an appointment scheduled as well through that route. And if they're an existing patient, then they can also reach out via my chart. So we try to be as accessible as possible. I can't guarantee that it'll be me or Marcus, but we have a team member who will be ready and willing to assist.
So if I understood you correctly, appointments are not necessary, are probably encouraged, but not necessarily a requirement. You don't have to have an appointment to come in and get help navigating the marketplace.
Correct. So they're encouraged, just because volumes, and we don't like to make people wait. But yes, walk-ins are accepted in all of our physical locations and primary care. We're in our Sandra Eskenazi mental health centers, and our specialty care areas. So we've got team members ready and willing to assist.
Yeah. So everything that they would need to know, everything they would want to know, and how to get ready for 2023 is all under the same umbrella right there at Eskenazi.
Yeah, it's the same. It's the same team. So our financial counselors, patient financial advocates can screen them for state coverage options if they're over income or don't meet that criteria. Then we transition to marketplace, and then we can also discuss whether or not they qualify for our financial assistance program, in addition to our sliding fee discount program in primary care. So it is literally like a one-stop shop for all of your insurance questions or concerns.
And if they had coverage from the marketplace for 2022, do they need to re-enroll for 2023, or is it like a passive re-enrollment? Like if you do nothing, you're automatically enrolled at the same level as you were for 2022. How would that work? Because I can see that there are people that say, well, I'm already in it, so I don't need to do anything. Or do they?
Yeah, so it kind of depends on your application from the previous year.
Okay.
There's a question on there: do you allow the data sources to be checked? And if you selected that option, they can use those data sources to kind of get that information and just re-enroll you into the same plan if that's what you choose. Um, you'll run into some cases where your plan that you were in last year may not be available this year. They can re-enroll you into a different plan. But they have people on their end too that you can call. They have a number. You talked about putting your personal information over the internet. You can always submit an application by calling the marketplace as well if you're uncomfortable with that. So yeah, the question is, yeah, sometimes they can just re-enroll you into the same plan. You just continue those payments if you filled out the application in a certain way the year before. But if not, give them a call.
Yeah. But it's still a good idea, just in general, to check your coverage and review it each year anyway. Even if so it's just a good idea to do that, even if you have to do nothing. Yeah.
Yeah, because I think your situation, may have changed from the previous year. So whether that's your financial situation, or maybe there could be changes like in your health status that impact, what makes sense for you from like a plan perspective.
Indeed. So before I have to let you both go, because I'll sit here and ask questions all afternoon. Before I have to let you both go, what is it that have we missed anything, or is there something more that you want to share or something you want to stress before I have to let you go? And Marcus, I will let Victoria go first this time.
I do not believe so. Just want to make sure that you've got our phone number, which is the 855-202-1053.
Could you repeat that? Yeah, repeat that again, please. 855. Okay, go ahead.
202-1053.
Okay.
That's probably the easiest way to get in contact with a member of our financial eligibility services team. And from there, they can answer questions, comments, concerns, get appointments scheduled.
Wonderful. And Marcus, closing thoughts here from you?
No, I think we covered everything. We can't stress enough if you need some help, if you have questions, any question, right? No question is too difficult for us to research and find the answer. And, if you think it's a simple question, don't, hesitate to call to get your questions answered. We want everybody to feel comfortable. And we don't want, payment to be a financial, we want to eliminate financial barriers to healthcare. So,
wow.
We encourage to use the number. So.
Yeah, indeed. And so as it goes, if anybody wanted to go to a website, is there a website you can recommend? If they, phone call is the easiest, 855-202-1053. Any recommended website?
Yeah, so if they go to eskenazihealth.edu, they will be able to find up-to-date information regarding open enrollment, Medicaid, and things like that.
Any thoughts on enrolling sooner rather than later, or what are your thoughts on that before we go?
Well,
I know. Okay, go ahead.
I would always encourage enrolling sooner than later. So if you have the resources, the opportunity to submit that application, get some help, we have appointments available before December 15th as well to get in to see us. And if you can, get that application in, get that payment made for that coverage to start January 1st. By all means, I would always recommend that. But if you can't, don't let that stop you. We still have the January 15th deadline for coverage to start February 1st.
You two are absolutely excellent. I tell you what, you are the best experts. Wow. It's amazing. Amazing. That knowledge. Y'all just learned that right about 10 minutes ago, right?
Every day we learn something new every day.
Yeah. Well, you are absolutely wonderful. And I cannot thank you enough for sharing your time. And hopefully a number of people will benefit from your knowledge and from the knowledge of your team. We most certainly hope so. And sooner rather than later, I think is a fair thing to say. Is that correct? Both of
It
you agree?
is.
Yeah.
Mhm.
Good. Victoria Evans and Marcus King, Eskenazi Health. Thank you both so very much. Hopefully we'll talk again soon, and you can let us know that thousands and thousands have enrolled and have removed the barriers, the financial barriers from healthcare, because that's basically the goal. And I cannot thank you both enough.
Thank you so much for having us. We really appreciate it.
Thank you.